The California Department of Healthcare Services, or DHCS, is sharing this video with County Offices of Education, or COEs, and local educational agencies, or LEAs, including charter schools, to introduce an important new opportunity to increase funding for school-based behavioral health services in public schools including K-12, colleges, and universities throughout the state. As part of the Children and Youth Behavioral Health Initiative, or the CYBHI, DHCS aims to expand access to school-linked behavioral health services by implementing a new and sustainable source of funding for behavioral health services that requires Medi-Cal Managed Care Plans, or MCPs, Medi-Cal Fee-for-Service, or FFS, commercial health plans, and disability insurers to reimburse schools providing covered services to students at a school site. This new program will go live with the first cohort starting January 1st, 2024, the second cohort in July 2024, and the third cohort in January 2025. This video will answer the following questions. What is the fee schedule? How does this CYBHI fee schedule differ from the Local Educational Agency Medi-Cal Billing Option Program, or LEA BOP? How does this fee schedule benefit LEAs? Which providers are eligible for reimbursement? What resources are available to COEs and LEAs to implement the CYBHI fee schedule? As part of Governor Newsom's Master Plan for Kids' Mental Health and the CYBHI, California is making critical investments. The CYBHI aims to transform the system of services and supports to strengthen access to services for children and youth with emerging or existing behavioral health needs. A pivotal component of this initiative is improving access to school-based behavioral health services for students under the age of 26 at all public schools, colleges, and universities in California. In an effort to expand access to school-based behavioral health services, DHCS is establishing a statewide multi-payer school-linked fee schedule. This fee schedule will define a scope of services inclusive of both outpatient mental health and substance use disorder services, identify applicable billing codes and rates, and specify provider types eligible to bill for services. The intent of this new program is to allow LEAs and their employed, contracted, or affiliated providers to obtain reimbursement from Medi-Cal MCPs, Medi-Cal FFS, commercial health plans, and disability insurers, which are obligated under state law to reimburse eligible school-linked providers. This includes pupil personnel services, or PPS, credentialed practitioners employed by LEAs to provide services to students. You may be wondering how this program differs from existing programs for school-based services, specifically the LEA BOP. Today, approximately 50% of all LEAs participate in the LEA BOP, covering about 90% of students across California. However, because the LEA BOP is based on a cost-based reimbursement methodology, LEAs must annually report and certify their public funds expended for LEA services that are eligible for federal funding. DHCS reconciles the reported actual costs to provide the LEA BOP services against the interim reimbursements received by the LEA to reach a final settlement. The difference between the interim reimbursement and the final settlement may be different from what the LEA listed on the cost report. Sometimes, the final settlement results in overpayments that must be recovered by DHCS or in underpayments that must be paid to the LEA. By contrast, the fee schedule reimbursement methodology is a straight fee-for-service rate, and there is no obligation by the LEAs to fund the non-federal share of services. This type of reimbursement methodology does not require cost settlement and does not require the LEA to participate in the random moment in time study that is required for the LEA BOP. If the LEA or its employed, contracted, or affiliated providers furnishes a covered service to a student, the LEA will be reimbursed at 100% of the DHCS published rate. Please note that LEAs can only bill for services or claim costs through one, not both, of these options for a single service to a student. In the coming months, DHCS will provide additional guidance on the interactions between the fee schedule and the LEA BOP. The CYBHI fee schedule will benefit LEAs by establishing a permanent and sustainable funding source for school-linked behavioral health services that increases access to school-linked behavioral health services for children and youth, eases administrative complexities for LEAs by streamlining processes and requirements for reimbursement of covered school-linked behavioral health services furnished to students and alleviating LEA burdens related to contract and rate negotiations with health plans, and applies to multiple payers including Medi-Cal MCPs, Medi-Cal FFS, commercial health plans, and disability insurers. This will ease the uncertainty for providers identifying students' coverage. This means more money going directly to LEAs for providing behavioral health services to students in schools or school-linked settings, such as community-based clinics where LEAs might refer students. The CYBHI fee schedule state statute requires DHCS to develop and maintain a school-linked statewide provider network of school site behavioral health providers and practitioners. LEAs will need to identify and designate providers and practitioners, including those who are employed, contracted, and/or affiliated with the LEA. LEAs will be reimbursed for services provided to students by any or all of the following: PPS credentialed practitioners, such as PPS school psychologists, PPS social workers, PPS counselors, and registered credentialed school nurses employed by the LEA, mental health specialists employed by or contracted or affiliated with the LEA, and/or community-based organizations or behavioral health providers designated by the LEA as eligible to deliver services to students. The state will provide ongoing supports to COEs and LEAs to ensure they are successful in implementing the CYBHI fee schedule. The state will provide ongoing technical assistance to LEAs as they build operational readiness requirements and begin utilizing the fee schedule. This will include, but is not limited to, conducting regular office hours and technical assistance webinars, publishing comprehensive written guidance, and providing coaching support for county, LEA, and health plan partners. DHCS also plans to contract with a third-party administrator, or TPA, that will serve as a mandatory statewide clearinghouse for claims management and payment remittance, and provide support to LEAs to make sure that claims meet federal and state requirements, and centralize LEA network oversight, including certain functions necessary to maintain the integrity of the program, such as credentialing and quality oversight. Thank you for taking the time to watch this video. The CYBHI is a historic and unprecedented investment in youth behavioral health supports. The state is committed to making sure the CYBHI investments in school-based services are successful and will provide support to COEs and LEAs as we move forward. The CYBHI is grounded in focusing on equity, centering efforts around children and youth voices, strengths, needs, priorities, and experiences, driving transformative systems change, and using ongoing learning as the basis for change and improvement in outcomes for children and youth. We look forward to working with you to further this vision. If you have additional questions, DHCS will be holding office hours in the coming weeks, the details of which can be found on the DHCS website. You can also email us at cybhi@dhcs.ca.gov.